This conference will now be recorded.
Hi, everybody. Welcome to our August Saturday call. Good to see everybody. I just want to go just around the room and see what's on people's minds and what they want to talk about. Tysharia, do you guys want to introduce yourselves?
Sure. I'm Tisharia, and I have with me my mother Sandra and my son Jaden. Jaden is a little shy, so he's not on camera, but he's here listening. Jaden is 15, and he was diagnosed with RMC on Halloween of 2023, and then we got the actual information that it was confirmed that he has RMC on November the 9th. And so I listened to some of the YouTube videos, and I think some of the ladies were saying about how they recognized that it was back pains and stuff like that. So I was constantly taking him to the urgent care for about a month and a half, urgent care and ER and his primary doctor, and they kept saying he had walking pneumonia. And so finally, we were in Columbia, South Carolina, and they did a test at the urgent care up there and said it was blood in his urine, and to go to the hospital in our area. And we did, and they did like a full exam and figured out that it was a mass. And so we were immediately shipped to Columbia, South Carolina, where we got the devastating news and results. And so at that point, they, told us he had a year, but just with my mind state, I wasn't accepting that. So I did my own research and things, and they said they connected with MD Anderson on his treatment plan. So he's been doing good. His first scan, it showed that the tumor had shrunk. And then his second scan also showed it shrunk and cleared up because he had it in his kidney, his right kidney, his lungs, his liver, and his lymph nodes. And it had cleared up. The first scan, it cleared up, the tumor shrunk. The second scan, it showed it cleared up some more, the tumor shrunk again. He had his right kidney removed on March the 28th of this year. And we did a recent scan in June, and it showed that it was only a small area that had it with his lymph nodes. And so I'm thankful for those results, I'm sorry, based off of where we started. So yeah, and so we're just continuing this journey, and I know Jaden will ring the bell and give his testimony as well. So
Awesome. Well, glad to have you here, and I'm glad everything's going well. Is there anything you guys have on your mind? Questions you have, or anything on your mind?
No, not at the moment. We're supposed to do another scan probably in the next 2 weeks and see what that scan is going to tell. But we just want to get on here and hear about everybody's journey and go from there.
and to let Jaden know, like, of course, he's not the only one going through this, because I think that was the biggest thing getting diagnosed was he was like, why me? And we just had to sit down and explain to him that, we don't know others that's going through this, but I'm sure there are others. And just doing research, we ran across a guy, I don't know if it was Herman or I forgot what his name was,
yeah,
but we ran across his information, and that was the faith of mustard seed that I needed to just keep going forward, to know that if one person made it, then Jaden will be in the number as well. So.
Well, if you guys have any questions, feel free to ask during the meeting. Jennifer, Jennifer, do you want to introduce yourself? Oh, you're still on mute, Jennifer.
Sorry. Hi, I'm Jennifer, everybody. My son, Antonio, he's 24. He was diagnosed in January. His symptoms started right around Thanksgiving. Um, and since then, he had his left kidney removed in June. Um, and his adrenal gland and lymph nodes associated with that. He's on his third line of treatment right now, and if he's strong enough on Monday, he had an off week this past week, so he starts again on Monday. And if he's strong enough, because he's not really eating that much, they're gonna add a couple more chemos to the mix. Um, so yeah, so he seems like he's doing okay right now. Besides the appetite, and we're just hanging in there, hoping, for good results.
For good results. Thank you, Jennifer. Do you have any questions or anything else that you want to ask?
Not really, no. Today was more just I was gonna the quick little update and just listen in.
Thank you. Well, thank you for being here.
Thanks. And nice to meet you, Teixeira.
Sorry, what were you saying, Jennifer?
I said nice to meet you, Teixeira.
Nice to meet you as well.
Brian, do you want to introduce yourself?
Hi everybody, my name is Brian. I got diagnosed with RMC back in 2021 of April. I had a nephrectomy. I had my left kidney removed because they saw a mass. My symptoms were blood in the urine, no back pain, but blood in the urine. So I went ahead and got scans. They found the mass on my left kidney, and they thought it was clear cell. Turned out to be RMC. Went through multiple rounds of chemo and radiation as well. And as of October of last year, I am NED, no evidence of disease. So right now, I'm just going for scans, and I had my last scans about a couple weeks ago, and everything's still clear. So yeah, that's my journey in RMC. So yeah.
Thanks, Brian. Amazing. Any questions you have or anything else you want to share?
No questions for me. If anyone has any questions for me.
Lois, do you want to introduce yourself?
Okay, hello, I'm from Greece, and my daughter was diagnosed at the age of 15 in March 2020 with RMC. We contacted Professor Mzawel and MD Anderson after doing some research because it was the first case in Greece, a rare cancer. Nobody knew anything about it. Unfortunately, we battled for 2 years, and then the disease spread a lot, and that was it. We lost her in April 2022. But since then, I have tried to connect with other cases like in this group, and I think a lot of progress has been done because I've been following all the posts by Anderson and Professor Mzawel, and lots of things have been done ever since. And I wanted to ask if I think Jennifer has got a son, right? If they're doing something with exercise, if they were athletes or something like that, and Teixeira as well. Do
Hi,
you?
Lois. Nice to meet you too.
Hi, nice to meet you, Jennifer. Is he doing something with sport? Has he been doing sports?
So he used to play football when he was younger, but in the more recent years he used to do a lot of running. So he would go on
Running,
like
yeah.
5-10 mile runs.
Yeah, because there has been my daughter was an athlete and had started to be involved in championships and things like that in track events. And Professor Mzal said that and proved that there is a connection with intense exercise to people with sickle cell trait. So just whenever I meet someone with RMC, I keep asking because I want to, to know if there's still the case. And from what I see, most people have had some connection with exercise. Yeah, because Nico in Colombia, I don't know if you remember, maybe the others, like you, Teresa, Daniel from Colombia, and Diana. They have Nico. Nico is doing pretty well because we exchange messages from time to time, and he was a footballer. Yeah, so yeah, most people.
Yeah.
Right.
Yeah,
So there.
Carlos used to do judo too, and that was pretty intense. So he was.
Carlos.
Mhm.
Yeah, yeah. Yeah, the majority of patients have had some connection with intense exercise. Yeah, exercise is advisable, but maybe the intense exercise or exercise with breaks. And when you're a champion, you cannot do breaks whenever you want, where you're in the middle of a race. You cannot stop. So probably that's the problem, or one of the factors anyway. Yeah, so I wish you a very good luck, and I'm sure that Professor Mzawel is doing pretty good work on that. And I'm very excited every time that he announces something promising and something hopeful, and or any new combination or something. Yeah, that's all. If you want to ask anything about my daughter's case. And it all started with pain, like Jennifer said, pain in the back. In my daughter, it started with pain in the femur and the leg. But she was an athlete, so nobody suspected something strange. And then a coughing, she started coughing, and we thought it was the beginning of a cold or pneumonia or something, until we ended up in the hospital, and where we found out the devastating news.
Yeah, thank you, Lois, for sharing.
Yeah, you're welcome.
Andre, do you want to introduce yourself?
Hey, can y'all hear me?
Yes, we can hear you.
Okay, good morning, everyone. My name is Andre. Um, I'm also one of the moderators for the RMC support group as well. I was diagnosed with RMC back in 2019. Um, just pretty much like everyone said, started with pain in my side, blood in the urine, and things like that. And Lois, I also was involved in like CrossFit, and I was deployed overseas in like hot conditions and stuff like that. So I think it definitely had an effect on me. But um, so yeah, diagnosed in 2019. My prognosis was 4 months. So it gave me 4 months to live. Um, so yeah, I remember transitioning down to MD Anderson in Houston. Um, under the care of Dr. Masal in Houston or whatever, and I've been through several different chemo regimens, immunotherapy, also radiation. Um, and I got my first clear scan in October 2020. So coming on, coming up on 4 years since my first clear scan. So it's been clear ever since. So you don't have to your doctor, they can diagnose you, but your prognosis is between, what I'm saying, your faith between you and God. So I am I have my testimony, 4 months and I'm still here, what I'm saying, 5 years since my diagnosis. So Main thing, try to stay positive. You know what I'm saying? Even though it's a tough journey, just try to stay positive and listen to the oncologist and keep pushing forward.
I have a question. You mentioned immunotherapy. Jaden has 12 cycles, and after we're on cycle 10, so two more to go. After that, they did mention immunotherapy as one. How I was just trying to read up on it. How was that for you, in your opinion?
So the immunotherapy is a lot better than like the chemo because the chemo it attacks the cancer cells and your what I'm saying, like your healthy cells, but the immunotherapy it pretty much it raises the defense level of your immune system to help fight off the cancer cells. So, I did have I think 6 cycles of the immunotherapy, but it's much less stringent on the body, compared to chemotherapy. So um, yeah, so it was helpful in my case, but I, I've had several different regimens. So I started with chemotherapy, then they switched me to the immunotherapy. Then the cancer became resistant. Then they switched me to like another chemo, and then I did chemo in conjunction with radiation. So I mean, it was it's a RMC. It's a tough journey. But I know in my case, I just, stayed positive, what I'm saying, kept my faith and, kept pushing forward. Even when the doctors told me that the cancer was becoming resistant, I still, try to stay in a positive mindset and focused on, what I'm saying, the goal, which is, what I'm saying, to be cancer free or remission, cancer in remission or no evidence of disease. So that was my goal. That was my mindset. No matter what the doctor said, I maintained that mindset throughout my process. And I know, that's it's hard to do that because your body's feeling one way. Um, that especially that initial fear and that initial doubt creeps in. But, I just tried to stay focused on the end goal. What is my end goal? And that was to be cancer free. So
Thank you.
I have a question for Tessria. Is Jaden in school or is he homeschooled?
No, Jaden was when we found out, he immediately did homeschool because he was missing days out of school anyway before we got that diagnosis. But he's homeschooled again this year.
Okay, okay. Jaden, let us see your face. We're not going to have you to talk. Just say hi. Hey, how are you?
Good,
You're a handsome young man.
thank you.
We're going to get some young ones on here so that you'll have someone to relate to, okay? We're just trying to get them to join our call. But we don't want you to lose the faith. I think Dylan is 16 and Nicola is now, I think, not Nicola, but Nico is now 16. Wasn't he 12 or 13, Lois, when he was diagnosed?
Uh, yeah, I think he must be something like 15 to 16 right now.
Yeah, because I think he's driving. So, but he was like
Yeah,
12
yeah,
when he was
I
similar.
think he was
diagnosed.
12. I think he was 12.
Yeah,
Yeah,
he was 12. So both of them are doing very, very well.
yeah.
And yeah, and then Misty's mom joined us this past Tuesday. Her daughter is she's getting there. She's responding to the treatment. So I said all this to say don't lose hope. Just keep your faith. You're young and you can fight this better than those old folks like Andre. And if he beat it, you can beat it. Okay?
So
I know
Right.
you're
they
shy, you don't have to talk, but I just wanted you to know that we're here for you.
they could
Okay?
have they could have a teenage group and relate to each other.
Exactly. I'm just trying to get them on the
Yeah,
call.
yeah.
Yeah, and then we have Brian. So you got some good resources to bounce back on. We can share their numbers with you if you feel more comfortable talking to a male figure. They'll be more than happy to talk to you and coach you through this.
Most definitely.
Okay?
Thank you.
You're welcome. But your grandma is who I met. Now we got your mom, so you got a good support team there. So that's what's important. And then we have Jennifer's son is young as well. How old is Antonio? 20,
Like 24.
24. So see, we got some young blood in the group. I'm the oldest thing around. So but it's all good. I'll be the grandma. So we just want to see your face and want you to feel comfortable. We won't have you to talk, but anytime you want to reach out to us, we're here for you. Okay?
Thank
All
And
you.
right.
Dylan could play video games with my son Philip. He's 14.
Yes, he could.
I don't know what games Dylan likes.
Oh, you mean Jaden?
Later.
Uh,
Jaden.
So, what games you play?
what,
Oh,
what,
His
what you
name
go,
is Jaden.
Jayden? Ah,
okay.
okay, sorry. Who? Dylan is Jennifer's.
Dylan is Lucy's son.
Ah, okay, okay.
They
I
hardly
was
get on
confused.
the call.
Jayden, yeah, because I hear Philip that he communicates with teenagers from other countries and they play video games and sometimes he get excited. And now he got stuck with playing chess online.
Wonderful. You have a
Yeah.
video game, Jaden?
Yeah.
That was a stupid question, wasn't it? I don't think there's no child without one.
Yeah.
Okay, we just want to make sure you, if you do want to do that, that you can. Okay. All right. Who's next? I'm sorry, Clarissa. I just took over, didn't I?
No, I think we went around pretty much for everybody. Richie, anything else like you want to share or anything on your mind?
I just wanted to remind everyone that Kidney Cancer Association is having their virtual meeting on September 21st. I think I did send out some emails regarding that if you guys want to participate. It is free. It is a virtual group. And I think the 21st is on a Saturday, if I'm not mistaken, in September. So if you didn't get the information and you're interested in participating, just let me know. Um, but just feel free to chime in when all these things come about. I mean, it's always good to be out there and get an opportunity to expose yourself. And then we also just organized a group, and Andre is participating in that group to see how we can come up with a more comprehensive education plan as it relates to sickle cell trait and RMC and other strategies is how we can champion for policy changes. So that is in the work, and as we get further along, it's like a working group. We'll be able to share more with you guys. But anything that you're interested in is such a huge platform and there's so much work to do. We would like for you to join in. And then I think I'm set up right before time for my trip, community outreach thing that's over in the Sunnyside area. We'll be setting up a booth for that. But other than that, that's about it. Oh, and we have Ron that's coming on the call. I can't wait to see him. There he is. Hey, Ron.
Hey, how's everybody?
Now the
Hey,
question is,
Ron.
how are you?
Okay.
I want to see your face. Don't take your face off of there.
Okay.
And Pam has arrived, so they coming in. There's what happened, Ron. Ron. Okay, Clarissa, you can go ahead on.
Yeah, I'm still on.
Oh, okay. Well, Ron, you want to just share with us what's going on?
Okay, can you see me okay?
Yeah,
Yes.
we can. We can. You driving?
No, I just got done meeting with the pastor.
Okay.
Finish up a couple of things, and of course, he he's a pastor, so he's a little more long-winded than I am. Well, what's going on is, as everyone knows, Julia passed away on the 14th, and um, I was there with her mom, and two of her best friends, and also um, one of her doctors, and so she just her heart slowed down and then tried to come back, and then it stopped, and that was that. Um, Prior to that, uh, um, we had gotten back from Houston on Monday from radiation. She went through 15 treatments, and I get a phone call. I was driving back from Michigan, driving back to Michigan, and my grandson said that EMS at the house to pick up Julia the same day, and she went into the emergency room, and they kept her in the hospital another week and a couple of days, and she couldn't breathe. The radiation, he had one large tumor, one medium-sized tumor, right lung, and um, at that time, I knew that there was another spot on her liver, so we weren't dealing with that at the time. But what I found out in the past week was that it it also spread in her other lung, her left lung. So now the first lung which was almost non-productive because of the tumors and all of that radiation. And her other lung is now, or was then, had cancer. She had cancer on her liver, and about 6 weeks ago, she had cancer, a lesion on the brain, which they took care of with radiation. Um, she was in a lot of pain, more pain than I ever seen before. And then now, um, she was requiring oxygen all the time, and she couldn't get enough. And they wanted to put a mask over her face, and she wasn't having it. She didn't, and a couple of times I had to uh, get her to leave the leads on for the electronics and the monitors, and she wanted to take off, her clothes. She didn't want anything touching her skin, and it makes sense that she didn't want a mask over her face. And she lost a lot of weight, a lot. And she and I talked about it, and I'm not sure if I hurt her feelings or what, but she would tell me that she could, she was trying, she was trying, she just kept trying, and I could tell that she was starting to slide because things were happening. I get a phone call and I'm told that she had a Foley. I knew that she was struggling with the oxygen. I knew her pain had increased. She was refusing to eat. But of course, I wouldn't tell anybody what I thought, but I could see it. And when she took her last breath, I was there with her. And I thought about something uh, during the service on Thursday. What I thought about was I watched her take her very first breath in life, and I watched her have a very last breath in life. So I'm still here in Indianapolis. The all of the, some of the well, I'm just taking care of a lot of loose ends, um, and uh, so a lot of stuff. I'm also waiting on her remains. Um, um, she's being cremated, and once I get her remains, I think that I'll probably head on back to Michigan. I'm going to have I'm going to split the remains with her mom here in Indianapolis, and I'll have a private gathering or ceremony up in Michigan. And Julia was a water person. She was a athlete, a swimmer. She loved the water. You know, she was with me all the time, pretty much on the boat. And I'm going to spread her ashes in the lake. She wanted to be and we talked about it. You know, she wanted to be near the water or in the water all the time. It's still like that. So I'm going to keep my promises, all of them, to Julia.
Ron, when you had a private service in Michigan, could you give me as much time notice as you can? I would like to be there. As long as it's not in October when I'm gone, but if you could give me as much
Okay,
leeway as you can, I would love to be there if possible.
okay, I'll do that.
Okay.
Yeah, she would love that. Yeah.
I just hate that I missed her homegoing celebration, but I'm glad to know that you're doing this, and that would give me an opportunity to uh, be there, and that's what I would love to do. And I just want to let you know that meeting Julia was indeed a blessing. Such a strong person. I knew she was getting tired as well. But Ron, you were there with her when she needed you the most, and that's remarkable because we don't often see dads involved in the care as I saw you with Julia. So. I just want to let you know that you indeed were a blessing to her, and I know it brought comfort and peace to her. And we just hope that you will continue to stay on with us as we continue this part of the journey. Um, Grieving is not easy. It's like an emotional roller coaster. You're going to have your good days and your bad days, but you can reach out to any one of us on those days that you just want to talk. I think we all are good listeners, but my heart is broken.
We'll all remember Julia. May I say something?
Yeah.
As I was hearing you, Ron, talking about the last moments of Julia, that reminded me of my daughter because it was like hearing my husband. My husband was there when Felina was born, so he practically saw her coming to life and taking her first breath, and it was in his hug when she left and left her last breath. So it was like hearing when you were talking, it was like hearing my husband. So yeah, they'll be together up there now with all the other young people that we lost to this fatal disease. Just to know that I will be remembering Julia. Yeah, always in our heart. Julia and all the others, but the people that we met, uh, it's more difficult, you know. Hope you're very strong for the rest of the family, Ron.
We will continue to keep you in prayer. Um, I just want you to know that you're not alone.
Yeah.
We're here for you. I think Pam has joined the call. Pam, give us an update. We hadn't seen you in a while.
Um, I no updates. I go back to Houston in 2 weeks. No, 3 weeks. It's about two now. Just for surveillance. So that's nothing really new on my end.
I was actually going to reach out to you because I hadn't heard from you in a while. So it's good to know that you're on this call. Okay.
Yeah.
Has everyone had an opportunity to talk this morning?
I went around all the room. Anything else that people had questions on or anything else on their mind?
I have a quick question. Just listening and doing research, I heard that it is normally in the left kidney, and of course, I said that Jaden was in his right kidney. Have anyone else heard of someone having it in their right kidney?
Yeah, my daughter had in the right kidney.
More cases are in the right kidney than the left kidney.
Yeah, mine was in my left.
Sorry, maybe I swapped it.
Yeah.
Yes, yes.
Mine was
Let
in
me.
the right kidney as well.
Yeah. What about Carlos? Wasn't Carlos in his right kidney?
Yeah, I think it was in his right kidney as well. Yeah.
Jennifer, what about Antonio?
His was the left.
Left. Okay. Ronald, what about? I keep saying Ronald. I see Ronald up here. Ron, what about Julia? Was it the right?
It was the left kidney.
Hers was the left kidney too. Yeah, it's more prevalent in the right. Pam, what about yours?
Mine was the right.
Was did Jaden play any sports?
Yes, Jaden played basketball, football, and baseball when he was younger, but because he has SC, sickle cell, it was like we were very cautious of him playing sports, but like when he was younger, he played it frequently.
Okay.
He has like the sickle cell anemia or just the trait?
No, he has the sickle cell SC.
Oh wow. I guess I hadn't heard anybody get an RMC. Most of the people I've heard had the trait.
Mm-hmm.
Yeah, when he was diagnosed, the doctor, his sickle cell doctor, when she was giving us the information, she stated, and I was shocked just listening to you guys and hearing the information. She made it seem like you had to be African American with sickle cell and a male. I didn't even know it was like females could even catch it, so or get it. it's shocking to hear, or it's giving me knowledge to hear you guys saying what you guys are saying after the information that I received. I guess I didn't do too much research after she said that those were the him having it, and him being an African American male with sickle cell, catching it. So
Yeah, usually the main factors are sickle cell trait and heart disease. We don't see as much in the sickle cell disease population, it's more in the trait. And then recently, the other factor is high intensity exercise. That's why I was asking if he played in any sports. But then there are also cases where people are diagnosed that don't have sickle cell trait, and that's the non-classified phenotype of RMC. So we're finding it, that it could affect anyone. Yes, predominantly African Americans, predominantly male, but there are females, predominantly the right kidney, but it does happen in the left. So there's just so much with this cancer. It's extremely smart and aggressive. And I can honestly tell you, Dr. Masao and his team are working very, very vigorously to find a cure. And I think they're doing a great job, as evident by Pam, Antonio, Andre, Brian. Uh, there are people, and even, the ones that are passed, their survival rate was improved. Whereas if we didn't have these other treatment modalities, they would not have had as great of a chance of survival. So there are strides being made. Of course, there's a lot more to do, but we are making progress. And basically, because of advocacy, because of each one of you sharing your story, we just need to continue to get more stories out there, um, so that the public will know it's just not one isolated incident. It's something that we need to be uh, aware of. You look at Lois, beautiful Fanina. You never thought she would have had sickle cell trait, So we just don't know. We don't know. You have Jennifer, they're Hispanic, so it can affect anyone. We just need to be aware of what's going on. And as I always say, knowledge is power. We cannot do enough to get the information out there. We need your stories, guys. We need your testimonies, regardless. We need to have it printed so that people can be aware of what's going on in this community. Jennifer?
Andre,
we would love to.
I had a question for you. You said that you had immunotherapy.
Uh-huh.
So just things that I've read, of course, they were saying that, RMC doesn't respond to immunotherapy. So it's kind of hopeful as far as what made them try the immunotherapy on you.
Um, and this was back, 2019, 2020. Um, I think Dr. Masao, and that's why it's important to, for your oncologist or wherever you at to stay in communication with Dr. Masao, because he doesn't wait that 1 second. Once the cancer becomes resistant, he transitions you to another regimen. So I started on chemo. Okay, the cancer became resistant. Then he tried immunotherapy. So I think everybody's body is different, um, and respond different to the cancer responds different in everyone's body. But I think Dr. Masai was just proactive in identifying any regimen that he felt could help me in my case. So the like I said, the chemotherapy first, it was working. The tumors were shrinking, and then it became resistant. And right after that, he switched me to immunotherapy. So he didn't waste, any time in between. So, and then the cancer was, the cancer was shrinking with the immunotherapy. Then it became resistant. So he switched me back to chemo. And the same thing after, that chemo regimen it was shrinking the tumor. Once it became resistant, he switched me to another chemo regimen, also in conjunction with radiation. So I was doing chemo every 3 weeks, and I was doing radiation, every day for like 28 days, Monday through Friday. So I was doing that and then doing the chemo every 3 weeks. And then once I finished that regimen, my scan showed no evidence of disease. So just, Dr. Masao, stays proactive, stays on top of your treatment plan. You got to be an advocate, because this cancer, like Ms. Ritchie said, what I'm saying, it's very aggressive. It's very aggressive and it can attack, your body parts fast. So just being proactive and staying on top of, those regimens and making sure that whenever that cancer becomes resistant, okay, maybe we need to try, a different regimen. And, they're always coming up with, this is why, I love Dr. Masao so much because him and his team are always coming up with, a different clinical trial or different research. There's more things available now than when, you know, uh, Miss Ritchie's son, Chris Johnson, was going through, RMC until, 5 years ago when I was going through it. Is other clinical trials available. So just, you know, be an advocate and make sure that your oncologists are pushing, what I'm saying, those treatment plans and just staying on top of it, I think is the main thing.
Did you treat exclusively at MD Anderson, or did you work through with your local?
So when I first got diagnosed, I was in the military, so I was stationed up in Washington D.C. So I had my nephrectomy at Walter Reed in Maryland, and they were going to send me they were going to send me to a cancer treatment facility in Maryland. But once I heard about Dr. Masal and Dr. Tanier, Herman Connor, I was like, I need to go there. You know what I'm saying? Because I wanted to be, in the presence, what I'm saying, of Dr. Masal, who works exclusively with RMC.
Right, because I know we usually he works with my local team or our
Hmm.
local team, and we go there for scans
Okay.
and to meet with them like every so often. But I'm just wondering if you know if it might be worth just trying just to basically just get MD Anderson. And I mean it's huge to like uproot,
Yeah.
but
It,
I don't.
I know it's difficult to uproot, and I think Dr. Masal does a good job of reaching out and talking to everyone's oncologist. I mean, he's great. I mean, you can email him. He responds fast and stuff like that. So he's great working with the team. But just in my experience, like I wanted to, what I'm saying, I wanted to be there, and I know uh, Carissa and Carlos travel, they travel back and forth or whatever. And I know Aisha and Gregory had uprooted in New York and moved down to Houston. So if it's possible, I mean, I would want to be, at MD Anderson.
Jennifer, too, I can say that I mean he has treated people over in Colombia. They've done well.
Mm.
Of course, so I think it's a preference, and I know it's hard to just uproot and move to Houston. And I would say if indeed the treatment protocol that he's offering, if you're able to get it where you are, then that's fine. I think it's when it boils down to the clinical trials that maybe Antonia would need to be a part of or qualified to be a part of it, then that's when you would need to look at moving to Houston because
Yeah.
they don't offer them anywhere else at this time. So, I mean, it's just food for thought. It is hard, moving back and forth, but yeah, because I know Andre and Alma, they burn that highway up back and forth. So, I mean, they were here. And, and it does get expensive, but I mean, there's no price on life. I mean, I understand that.
Yes.
But
And
just,
I just I just worry that, with them not, they've had maybe a couple of people that have had it. I know that the one gentleman, he's Ned now, and he was being treated at Dana-Farber. But I just feel like I don't feel like he's getting the attention, or like they just feel like they've given up or something. You know, I don't know. It's just how I feel.
I,
Maybe it's not true, but I just
I
are
know
they, okay, I'm sorry, go ahead, Andre.
I know in my case, I mean these were I was at Walter Reed and these were, like this is kind of like this is where the president gets treated, but they didn't know anything about RMC and they didn't make me feel like when the oncologist came into the room, you know what I'm saying? I felt like he had already given up on me. And, it wasn't a good feeling, you know what I'm saying? So once I got to MD Anderson and got into, the presence of Dr. Masal, his optimism, his, always looking for, what I'm saying, like the best treatment, it made me feel better on the inside because I knew he was doing everything in his power to figure out the best treatment plan for me. I wanted
Can,
someone to believe in me, and I know Brian can speak on this as well because he gets treated with under Dr. Masai. But man, I wanted somebody that was believing just like I was believing.
can I add something to that? I live in Montana, and so I had my my chemo regimen up here. I actually had to switch oncologists or organizations because of scheduling reasons, but it's a huge difference when you have an oncologist who accepts what they don't know and accepts help from people who are specialists, and the oncologists who are feel like they've done the research, they don't want to listen to anybody and kind of use people with RMC as experiments. So I don't think traveling to Houston for treatment is as important, except for clinical trials, obviously, than finding an oncologist locally who's willing to listen and understands what they don't know.
Yeah. I
yeah,
mean,
I
I
know
felt
that.
like when Carlos got diagnosed, like the first thing his doctor said, she knew like Dr. Tener, and she told us like, oh, like this is a specialist. I'm gonna go. Like she said, she was close friends with him, so she said she was gonna talk about. She told me she had different avenues. She was talking to that she was thinking about. So she talked to him and got like advice there, and then we did some clinical he was on chemo for a little bit, got his kidney removed, was in a remission, and then like it came back. Like he was in a clinical trial in New York, and like when that didn't work, he was like he was being in another clinical trial doctor, and they were going to do something within. But then I reached out to her just to tell her what was going on, and then she's like, "No, I think you got to go to Texas now." So like I had like two instances where people people trying to go within, but like with her, like she kind of was very upfront on what we should do and not like making sure she was looking at different avenues and seeing like when she, like getting expert advice. And then there was a point like where he had to do clinical trials, so we were like flying back and forth to Texas like every other week for month for like some months at a time. And Carlos just wanted to, he was like very big on family and being around his family, and I think that kind of like helped him like with his mentalness, because that's very important, figuring out what you need to be like as mentally strong like during this. So he wanted to fly back and forth to Texas, not like move, like he didn't want to move to Texas. So that what he like decided what he wanted to do. And Dr. Masao said like agreed with that, like whatever he needed to do, like to keep himself mentally strong. So like he was a big family person. But then there was a point like where we had done different treatments, where they said we could get them treated in New York. So I went back to that doctor because I trusted her. And then we like would just go for scans back to Texas. So like that's kind of like, so I feel like for like different people could be like different too, because everybody has like like being like like doing what you need to do mentally, like is different for everybody, like as well. So I think that's like something big to consider. Seemed like for like Aisha mentioning with Grigor, he loves like being in Texas. That was like the move for him. Um, Carlos a little bit different, right? So, but I know like Dr. Masao was pretty open to talking to us like what he thought like would be good for plan, and if we could get the treatments like back in New York or stay like flying back and forth to Texas every other week.
Thank you. Thank
And
you.
there are a lot of good resources out there as well. For transportation and housing and stuff like that. That type of stuff, especially for housing, you gotta kind of be like proactive because sometimes there's waiting lists and stuff like that. But they do offer like housing near the medical center in Houston. Um, yeah, so if you need any help with trying to find resources, I can share with you some. I know Carissa knows a lot of resources as well. So we'll be happy to share those with you if you're thinking about, that transition.
Yeah, definitely. Any other questions people had or any other thoughts? All right. Well, Andre, do you want to close this out? You're on mute.
Yeah, I can close this out. Um, want to thank everybody for sharing their thoughts with our support group. Like I always say, we are, this is, like a family, so we stay connected, we share ideas, we, what I'm saying, uplift, uh, and we be there for one another. So I want to welcome uh, Jade and his mom to our group. Um, and we are definitely with you throughout this journey. We have people that have gone through it and came out on the other side. We have, caregivers, and we also have, people that have lost loved ones as well. So we are here for you, um, and to run. Our prayers are definitely with you. You know what I'm saying? We uplift you. We just encourage you to stay strong. And um, man, it was such a pleasure to meet Julia at the walk. Such a great spirit, and thoughts and prayers are with you. And we are going to continue raising awareness. We're going to continue, until, and Dr. Messiah promised, he promised us, that they will definitely find a cure for this disease. So no one, has to, mourn a loved one from this disease. So we are going to carry that baton for Julia, for Chris, for Carlos, for Nina, all the ones that we lost to RMC. We're going to continue to carry that baton and continue to raise awareness, continue to, put our feet on the ground and talk to, legislators. Milton is doing a good job of you know, trying to get stuff done, through the legislature, so we're gonna definitely keep pushing forward, um, until we come to that goal. So thank you all, for coming to the meeting. The next meeting is
September the 10th.
September the 10th. So looking forward to seeing you guys again. So um, stay blessed, stay positive, stay encouraged. And as always, if you need anything, Miss Richie is right there. I'm there. I can put my number in the chat. Carissa, uh, anything that we can do to help y'all through this process, we are here. So thank you once again.
Have a great weekend.